laser whitening agents an effective and safe approach. Without further ado, please.
Good morning. As a general rule, darker skin patients are often underserved in aesthetic medicine due to the limited number of studies and the scarcity of treatment options specifically designed for higher phototypes. Those higher phototypes are still not included in most studies due to the risk of hyper and hypopigmentations when subjected to CO2 lasers. A phototype is not determined solely by skin color, rather the combination of skin tones, hair color, and eye color. Then skin phototypes are classified into 6 categories. Those categories range from free-spectrum skin type 1 to 6. Most of the time, only skin types 1 to 3 are treated with CO2 lasers because of its safety. However, the focus of my lecture is specifically on free-spectrum skin types 5 and 6, which correspond to black skin phototypes characterized by significantly dark skin tones, black hair, and dark eyes. The protocol that I have developed, we are able to safely and effectively treat patients with darker skin phototypes in a comprehensive and effective manner, achieving highly satisfactory outcomes, particularly in the reduction of hyperpigmentation and melasma. As an added benefit, we also observe skin rejuvenation, improved texture, and enhanced overall skin quality. Then I would like to properly introduce myself. My name is Dr. Amália Zanon. I am an aesthetic doctor from Porto Alegre, Brazil. I am passionate and specialized in technologies and age management. I am proudly recognized as one of the nation's reference in fractional CO2 laser treatments in Brazil. Therefore, this year, I was invited to serve as a co-author of the first Brazilian textbook dedicated to fractional CO2 laser technology. I authored a chapter on multimodal treatment of the neck and the colletage, in which I combine energy-based technologies and chemical pills for the treatment of those sensitive and challenging areas. I developed a multimodal technique that combines fractional CO2 laser and cold mode settings in a multi-layer treatment approach in the same session called Renovance method. It can also be combined with an ND-YAG laser. The pigmenting agents and chemical pills function as a skin sealing protocol primarily aimed at facial rejuvenation and comprehensive aging management. Here's a general overview of the protocol that I will be describing. From skin preparation to pre-procedure, the procedure itself, and also post-procedure care. A true facial rejuvenation demands a multi-layer approach. At the epidermal level, we target pigment and texture using lasers, peelings, and skin boosters. But to reverse the actual aging process, we must look deeper to the dermis, combining collagen biostimulators, HIFO, and fractional CO2 to treat through structural laxity and wrinkles. By strategically addressing both layers simultaneously, we move past isolated treatments to deliver comprehensive, satisfactory, and long-lasting outcomes that our patients can actually see. For the success of this treatment, the skin preparation is a mandatory step. Then I prescribe the Klickmont formula for 50 to 21 days prior to the fractional CO2 laser procedure to inhibit the production of tyrosinase. Tyrosinase is an essential enzyme in biosynthetic pathway of melanocytes responsible for the production of melanin. Increased melanin synthesis is mediated by the skin enzyme. That's why skin preparation is essential to inhibit tyrosinase activity and therefore prevent post-inflammatory hyperpigmentation. As the years go by, cellular renewal slows down, and oxidative stress increases, making the use of treatments such as lasers and pills essential. Those procedures are fundamental in interrupting the process of cellular senescence and restoring skin function, promoting a healthier, more rejuvenated and clear appearance, broadening this procedure to higher skin phototypes. I believe the main objective of this technique is the improvement of skin pigmentation. With the combination of laser and peel feeding procedures, we are able to restore the skin's normal physiological function. Today, fractional CO2 laser is considered one of the most complete treatment modalities available, as it addresses hyperpigmentation, wrinkles, skin texture, and large pores, and also stimulates true autologous collagen production through the remodeling of collagen and elastin fibers. Although the target chromophore of the CO2 laser is water, the treatment creates microscopic thermal zones and ablative columns within the skin, promoting the physical extrusion of pigmented tissue, providing a significant skin lightening effect. Here we can clearly see the concept of microscopic thermal zones in the skin. The laser creates ablative columns as the laser beam penetrates the skin production vertical channels of ablation surrounded by healthy tissue, which allows for faster healing and recovery. Here we can observe the difference between fractional and non-fractional laser technologies. Fractional lasers may be either ablative or non-ablative. The focus of this study is fractional CO2 laser, which is both a fractional and ablative laser modality. Fractional CO2 laser has one of the highest wavelengths used in anesthetic laser technology. Then, when I combine it with the NVIAC laser operating at 1064 nanometers, whose target chromophore is melanin, I am able to achieve highly expressive clinical outcomes. When treating patients with higher skin phototypes, the density settings of the fractional CO2 laser application are extremely important. We must reduce the density of the ablative columns in order to preserve a greater amount of healthy epidermal tissue, thereby minimizing the risk of melasma rebound and preventing excessive heat accumulation within the skin. One of the reasons why lower density settings are so important during laser treatments, specifically in higher phototypes, is that the thermal energy disperses into the deeper tissue beneath the epidermis. Therefore, although the laser spots appear very localized at the skin surface, in the deeper dermis, the thermal energy is spread into the surrounding adjacent tissue. For this reason, I recommended randomized application patterns with lower density settings in higher phototypes. When using the laser in cold mode settings, the pulse duration must be very short. As demonstrated here, this is the ending point for higher phototypes. Here's a comparison of the ending point in lower phototypes. As you can see, the desired clinical ending point is a distinguished brownish hue. I use a pulse duration of 150 microseconds with a maximum energy setting of 4 millijoules, randomized application over a 20 by 20 treatment area and a maximum of 256 spots per treatment zone. Right after the CO2 laser, the drug delivery serums utilized for skin lightening included 10% tranexamic acid, hydroquinone, which remains the gold standard depigmenting agent, and exosomes, which promote extracellular matrix regeneration. When combining laser treatments with chemical peels, specifically in patients with higher skin phototypes, we must work exclusively with more superficial peeling agents. The post-fractional CO2 laser sealing mask utilized contains 10% retinoic acid, 10% tranexamic acid, and must stay on the skin between 4 to 8 hours. The use of retinoic acid after fractional CO2 laser treatments helps prevent cross formation, reduce recovery time, and enhances collagen stimulation. Tranexamic acid further promotes skin lightening by acting synergistically with the pigmenting agents. And finally, where does the heat go? As the laser beam penetrates the tissue, it creates controlled tissue injury. Then after the laser application, the generated heat is absorbed by the tissue, producing thermal elevation initiating vaporization. Tissue removal occurs as the intracellular water evaporates, and when cooling is not performed, the resultant thermal injury is significantly greater, specifically in higher phototypes. For this reason, a 30 minutes skin cooling is extremely important as it helps dissipate heat and reduces excessive tissue vaporization. Therefore, skin cooling not only improves patient comfort, but also helps prevent post-inflammatory hyperpigmentation by accelerating heat dissipation within the adjacent tissues and the deeper derms. The post-procedure guide is: the first 7 days, only apply recommended creams. After the first 7 days, I will introduce the Kligerman formula using the following protocol. 2 weeks applied nightly, followed by 2 weeks applied 3 nights per week, then 2 weeks applied 2 nights per week. Afterwards, the formula is discontinued and the patient remains on retinol-based home care for many times and aiming to prevent post-inflammatory hyperpigmentation and rebound pigmentation. Here I present a before and after example of hyperpigmentation treatments in patients with higher phototypes. This is a younger patient, while the second patient is older, around 60 years of age. In addition to significant skin lightening, facial rejuvenation, and improvement in overall skin quality, we are also achieved. This method has proven to be safe and effective for the treatment of higher skin phototypes. In this way, we are able to expand our range of therapeutic options and broaden the population of patients who can safely undergo laser treatments. We no longer need to exclude patients solely because they have higher phototypes. Fractional CO2 laser and chemical peels can now be performed safely for both hyperpigmentation treatments and facial rejuvenation. Here are some take-home messages to apply in your clinical practice. Always associate CO2 laser with retinoic acid for all phototypes to accelerate the skin regenerative process. Be aware of the ending point for higher phototypes to avoid hypo and hyperpigmentation. The skin preparation is mandatory to all melasma and hyperpigmentation treatments. Thank you very much. Muito obrigada a todos.
Thank you very much. Is there any audience questions? Please raise your hand and we can provide you with a microphone. Any questions?
Hã? Essa flecha? o meu.
Tira o flash.
O teu tá sem memória. Esse é o meu. Esse tá sem flash.